So today we are joined by two presenters. We have Cha Lee, who's with Health Management Associates, and Carice Burnett, who's also with Health Management Associates. And if we can switch to the next slide, we can get a preview of who they are. But HMA is the DHCS training and technical assistance contractor for the CARE Act project. And Cha and Carice have been working on the data side. And HMA also, in addition to the TA, which we've been providing on implementation, we also support the CARE Act data collection and reporting, including developing and managing the data collection and reporting process, submitting county BH data collection efforts, supporting development of annual report, and assisting DHCS, assisting their independent evaluation contractor with the data collection to determine program outcomes, impact, and lessons learned. So today, like I mentioned, our presenters will be Cha Lee, who is a data analyst and researcher with data collection, management, analysis, interpretation, and visualization experience. And then also Carice, who is a data analyst who's done a lot of work to alleviate inequities within the healthcare system related to data, and has done work with creating interactive dashboards to analyze and visualize community needs using both qualitative and quantitative data. Let's take a look at some of our learning objectives for today. So the goal of our session today is to identify county responsibilities for data submission. We're going to be going over SurveyMonkey today. A future session we'll talk about MOVEit, but we'll talk about both of those mediums today. Understand the county data flowchart used to collect the required data in SurveyMonkey, and then actually go through and look at what that process for entering data into SurveyMonkey looks like. So let's take a look at the agenda. Those were our objectives. So our agenda today, first session focusing on reporting responsibilities and data mechanism, and looking at what that looks like. And then the second session, Cha will lead us through an actual demonstration of how to enter that information into SurveyMonkey. This session is 90 minutes so that we can accommodate a healthy Q&A period. If we don't need all that time, we can all take a little bit time at the end, but we're certainly willing to stick around and troubleshoot issues that come up. And we mentioned in the email, but we will be sharing this recording and the slides with this group, anyone who registered. So if you have to drop off early, we will, that's okay. We'll be planning to share this, this recording and the slides in the next few days. So that's the introduction that we have today. I think we'll just jump into the next section on data responsibilities and reporting mechanisms. And thank you everyone for joining.
Hello everyone, thank you for joining. So here in this next section, we want to give you an overview of data reporting responsibilities and reporting mechanisms for CARE Act participant data. Here we will review the data reporting responsibilities for Judicial Council. If helpful, please follow along with the data dictionary. A link will be placed in the chat now, or you can follow the link provided on the slide. Judicial Council is responsible for collecting 6 data points, 3.2.1 through 3.2.6, total petitions submitted, total initial appearances, initial hearings held, total hearings held, total care plan ordered, total care agreements approved, and total petitions dismissed. These data points will be reported at the aggregated level and stratified by county. Trial courts will not have a mechanism to submit data to DHCS. They will submit data to Judicial Council, who will submit data on their behalf. On the next slide, here we've provided the data reporting responsibilities for county behavioral health agencies. You'll see counties are responsible for the remaining data elements. 3.3 basic client information to 3.13 hospitalizations and emergency department visits at the individual level to the extent that data is available. Differently from Judicial Council, counties will report the data at the individual level. The next slide. Now that we've covered data reporting responsibilities, let's cover how Judicial Council and county behavioral health agencies will submit data. There are two options for submitting data, either via SurveyMonkey or MOVEit. While there are two options for data submission, every reporting quarter, counties can only choose one mechanism to submit the data. For example, in January of 2024, if County A chooses to use SurveyMonkey, all data must be entered into SurveyMonkey manually. Today, we will focus on SurveyMonkey. However, information in this training is relevant to counties planning to bulk upload data via MOVEit. Because we will be walking through the data elements required over time, understanding this will help counties as they develop or adjust their data architecture to support collection of data for the different care client groups and where they are during the care process. Next, we'll provide more detail on SurveyMonkey and MOVEit. Here's a little more information on the SurveyMonkey platform. It is a popular survey and data collection tool, so many of you may have already heard of it or used it in your personal and work life. SurveyMonkey is the cloud-based service selected to host the CARE Act data collection and reporting DCRT. The DCRT has logic built in, so it will only require the data points that are relevant to the client's current care status. For those county behavioral health agencies that want to do manual data entry, they can utilize this option. Users can save and return to responses before submission. However, once the survey is submitted, users will not be able to make any changes. On the next slide. The second option for county behavioral health data submission uses a process where a file template is uploaded to the MOVEit platform. MOVEit is an existing mechanism for the transfer of data used by DHCS. HMA will provide a file template that aligns with the structure of the CARE Act data dictionary structure. The file format will allow Judicial Council and county behavioral health agencies to query data from their existing data systems. County behavioral health agencies that don't want to enter or re-enter the data into SurveyMonkey manually can use this option. On the next slide. A common question we want to cover early on relates to unavailable information. What should you do when information for a data point is not available? For a date data point, the county behavioral health agencies can use 999999 to indicate that it is unknown. Sometimes the date is not applicable. If this is the case, please use 999998 to indicate that the data is not applicable. As an example, for 3.3.7 petition file date, county behavioral health agencies can enter 999999 if the petition file date is unknown. For the numeric or text data points, the option unknown is available to be selected if using SurveyMonkey. If a file format is used, please use the value code 99999. Sometimes there will be a situation where information is unavailable for a data point, but the CARE data dictionary does not have the option unknown or not applicable for that data point. If this is the case, county behavioral health agencies can leave the data point blank. And next, I will pass it to Cha to get us started in the next section.
Data collection flowchart. Now we want to move into a demo of the SurveyMonkey platform. Before we do that, we think it is helpful to basically look at this high-level data collection flowchart that show how 3.3.10 current case status actually determine like further data collection and data reporting. The logic that we put in SurveyMonkey, it is actually based on this flowchart. The full detailed flowchart has been provided as a resource in PDF form on the CARE App website. You can also like download the full flowchart directly using like the link below here. I think Carly will basically share the link in the chat as well. Yeah. For this flowchart, it actually like lists all the required data point based on like the current case status. It is telling you exactly what you need to collect from like the first data point all the way to like the last data point. And if you like have the data flow chart open, right? If you look at it, basic client information and demographic information will be required for all care respondents that flow through county behavioral health, regardless of whether they end up receiving county behavioral health services. Once the court actually has made a determination about the disposition of each care petition, county behavioral health will be required to report on the current care status at the individual level. If you look at the data dictionary, it is actually 3.3.10 current care status. It is the second yellow box. Yeah, so county will be required to report that. There are a number of options you can see in the blue box right below the second yellow box. And a client care status can actually change over time. Each potential care status is showing here in blue. You can see that if additional like data collection and reporting will be required below like each box, you will see that like not all the care status like they will share like the same like required data point. Like if you look at termination, right, we are required to like report like the date of termination and the reason for termination. But if you look at the dismissal status, it has a different data point that is required for the county to report, and that is like petition dismissal date. Especially for clients who are actually not eligible for care or those who do not end up receiving county behavioral health services, please note that this client will not be tracked further if like once you provide like the date of dismissal. And it is also indicated in here in this flowchart and also the full detailed flowchart. Yeah, so you just need to like provide the date of dismissal, and after that you are no longer required to track them further. Can I go to the next slide? Idea in action. Now we want like to pause for a second to put this idea into action. It is very important for those staff who are responsible for data reporting like to kind of get used to like the data flow chart and also understand how it like supposed to work. That we have referenced like in the previous slide. Now I would like everyone to take like 60 seconds to basically review the data flow chart in depth and kind of look through like the required data point under each care status. And as you like going through the flow chart, we want you to like specifically focus on the dismissal status and also the care plan status. The reason is that while we are doing the demo on SurveyMonkey, we're going to be using those two status to show you how SurveyMonkey is supposed to work and to show how like the logic actually moving from point to point. Yeah, so we want you to focus specifically on those two status. And now like I will wait for a few moments for you to basically like open up the data flow chart. Yeah, and make sure that you have it open. So like while I walk through it, you know exactly what to expect, like the next data point to expect. So like I'm gonna give like at least 60 seconds. Yeah, so you can have it open, just go through it and identify like the required data point on the each care status. The flowchart, it is huge, but when you look through it, just focus on one status at a time. So you don't look at the overall like flowchart. Just specifically focus on each status one at a time. Yeah, and just going down directly from there. It also tell you like the branching like data point in the orange box, and it telling you like what need to happen in order for those to come out. Carly, I think that is 60 seconds, right? Okay, yeah, so we can move to the next slide. And I just want to say again, for that flowchart, we highly recommend that when you are using the file template or when you are submitting data using SurveyMonkey, always have that open along with the data dictionary. The data dictionary gonna tell you like about the value code and the option choice. The flowchart gonna tell you exactly what need to be collected. So we recommend you to like have both open. Everything should be going in order from top to bottom, and with the flowchart, it tells you exactly what you need to collect. And now we want to move to a live demo of the SurveyMonkey platform. But first, we want to set the stage and share a case example that we will use to guide us through the data collection process. So basically, we will be using a hypothetical case that requires CARE data submission. So let's meet Ming Wang. Ming Wang is a 42-year-old single woman who has been enrolled at Stanislaus County Behavioral Health, where she has been diagnosed with the disease that qualified her for the CARE program. We know that she lived at a broad and care home, but has been increasingly disappearing for up to days at a time. She was not adherent to stabilizing medication. She was becoming more paranoid with her caregiver, accusing her caregiver of stealing things from her and controlling her thought. Her family decided to refer her to the CARE program for support and services. After going through the initiation process for the CARE program, she was determined to be eligible for care by the court. She is now on the care plan that include behavioral health treatment, housing, and other support. And as a disclaimer, this is only a hypothetical case example, not a real person. Yeah. So can we go to the next page? Before we actually start on the demo, we think that it is important to like mention about the key takeaway. So while we are doing the demo, and you will see that, all right, demographic and basic client information are required every reporting month. 3.3.10 current care status is very crucial every reporting month, because when you report on that, it is going to determine the subsequent required data point, like telling you exactly what you need to report back to DHCS. The data flowchart is a guide to data collection and reporting for County Behavioral Health Agency, the one that we tell you to like always have it open while you are doing like data collection and submission. It actually lists all the data point based on the care status, including like the branching data point. Can we go to the next page? All right. Before we start, I have provided a link to like the survey in SurveyMonkey. Carly also like paste the link inside the chat, so you can just use the link directly. We encourage you to like follow along while I am doing the demo, so you know how it actually supposed to work. Yeah. When you are using the link here, the link in blue, or you can just click directly in the chat to like access the survey. It will be asking you for a password. For all county staff who are doing data entry and data submission, they will be provided with a link and a password. The survey always going to be password protected, because we don't want anyone to just go in there and then technically enter random data. We don't want that to happen. So it is always going to be password protected. Yeah, so that way we know that, all right, only those people who have access to like the survey can actually do the data entry and the data submission. When you click on the link, it will drag you to a page that asks you for the password, and you can just enter CARE 2024 with the exclamation mark. It is all cap, yeah. Once you enter the password, it will direct you like directly to like the first page of the survey. And once you get there, please hold. Yeah, please hold before we start. And as I actually like showing the demo, if you have any question, feel free to put it in the chat. You can just use the chat feature. You can enter your question. At the end of the demo, we can like go back to those questions and we can basically answer them. Yeah. So we're gonna go over the question at the end. So any question, feel free to put it in the chat. We have the instruction in the blue box, and you can basically use the instruction to like enter the question. Any question you have, please be specific as possible, so that way we know exactly where you are referring to like in the data dictionary. Yeah, so that way we also know like where to locate the information from the data dictionary. And now I actually will stop the presentation slide, and then I will show you how everything's supposed to work on SurveyMonkey. So let me share my screen. Give me a second. And as a reminder, any question, feel free to put it on the chat. Yeah. All right, so when you click on the link, it is gonna direct you to a page like this, asking you for the password. And earlier we said that the password is gonna be CARE, all cap 2024 with the exclamation mark. Let me check quickly. Yep. And then you're gonna click submit password. Once you click submit, it is gonna take you directly to the survey, and this is the first page of the survey. It gives you a quick intro like to the survey before you like start answering question. Yeah, it also has detail like how to save response. Like all you gotta do is just click next, and everything that you have answered in the previous page should be saved automatically. We also indicate detail what to do if like when a data point, like you don't have information for a data point. We also mentioned that earlier in the previous slide. Yeah, so what to do when information is not available. At the bottom of the introductory page, we also provide you with a link. If you have any question, any technical issue, if you want to like correct data for a client, we want you to submit a request form, and we provide a link right here. Yeah, so you can just click on it. It will direct you directly to like the form. You just need to submit the form, and a member of our team will basically get back to you and work with you. Yeah, so anything, we need you to submit a request form. So once we have like read through like the like welcoming page or the intro page, and we feel comfortable, there is a box down here saying next, right? You can click on next to go to the next page. So I actually like have been reading through it and I feel comfortable, so I'm gonna click next. When you click next, right, it is directing you to like the first reporting data point, which is what reporting month, and that is 3.3.1. Yeah. You can see that we have a star right here. It means that it is a required data point. And for us, it is also very important for us on the back end because it serves as a timestamp. That way we know exactly when it is coming from. If we need to correct the data, we can just use the date to just go back to it and locate the record. Yeah. So it's a very, very important like purpose for us on the back end. You cannot go to the next page until you provide a date. So if I try to go to the next page, right, technically I can't until I provide a date. Yeah. And we think that it will be useful that we provide the data point number. Yeah. So with the data point number, if you want to locate the data point in the data dictionary, if you want to look for more info in the data dictionary, you can just use the data point number to locate that data point in the data dictionary. Yeah. We also provide the additional specification, telling exactly what you should do for this data point in red font right here. Yeah. And when we look at the additional specification, we actually saying that we want you to report the date based on the last day of the reporting month. So for example, if January 2024 data is being reported, right? We want you to enter the last day of that month. So it is going to be what 01, 31, and 2024. Yeah. So that's how you're going to enter it when you report back to us. And for our case example for Ming, right? Let's assume that we are submitting data for her in the month of January. So if that is the case, we're gonna enter January 31st. Okay, January 31st, 2024. Okay, so we're gonna enter that, and then we can click next to go to the next page. The next page, it is going to be basic client information. If you look at the data dictionary and you have the full detailed flowchart open, basic client information and demographic information are always required for all care respondent. Yeah. And if you look at the full detailed flowchart that we asked you to open earlier, you can see that, all right, basic client information, it is the first element, yeah, the first box on the flowchart. And when you look at that, it's telling you exactly what you need to report. You will need to report what 3.3.1 all the way to 3.3.9. Yeah, so those will be the data point that you are required to report. Now, I'm gonna basically move through the question, and then I'm gonna show you how we're gonna answer it for Ming. But as a very, very important reminder, always look at the additional specification that we have put in red right here. It gives you more detail about the data point, and if you want to have more detail, this is where you're gonna find the detail. Yeah. So make sure you read through it before you provide a value for the data point. Right. So we will be using Ming 1 as an example. 3.3.1 asking about the county, right? And earlier we said that she's from Stanley County, so we're gonna select that county. Yeah, so we're gonna select that for 3.3.1. Name, we're gonna say, all right, she's Ming. 3.3.3 asking for last name, so we're gonna say, all right, Wang. And then 3.3.4. This data point, it is also very important for us because we're gonna use that to determine the age. With the date of birth, we're gonna use that with the date when the petition has been submitted, or the date of investigation. We're gonna use that two together to basically determine the age for the client. Yeah. So with the date of birth, it is also gonna be very, very important. From the detail earlier, we know that, all right, she was 42 at the moment. So let's assume that she was born in what September 5th, 1981, and that should make her about 42 years old. 3.3.5 asking about Social Security, and again, that is the reason why we want you to focus on the specification, because on here, right, if you read the question fully and you look at the specification, it is telling you that, all right, if Social Security is not available, right, if it is not available, you can use the Medi-Cal beneficiary number. Yeah, so you can use that. But we also want you to stay consistent. If the first time you report the data and the Social Security is available, right? We want you to continue using the Social Security throughout the care process until you stop tracking that client. If the first time you submit it and Social Security is not available and you are using the Medi-Cal beneficiary number, right? we want you to continue using the medical beneficiary number throughout the care process. Yeah, you cannot switch between Social Security and medical beneficiary number. Yeah, we want you to stay consistent so we can like map everything together back to where it's supposed to be. And it also help us determine if the client is new or the client already in the system. So it serves a very, very important purpose on the back end. Yeah. On here, we have a case example. We don't have the Social Security, so let's just enter a random Social Security in order to like go to the next page. And as a note, as you can see right now, I don't make all this data point required for basic client information. And the reason is that I'm doing it for the training. So if I take them out, it will be easy for me to move around. If I make them required, it will be hard for me to like basically go to the next page or go back until I actually provide an answer. Yeah. So I remove them, but when you are filling out the survey, it is going to be required for you. And right here, let's just enter a random Social Security number. So we will say 1, 2, 3, 4, 5, 6, 7, 8, 9. And under the additional specification, we say we don't want any dash. Yeah. And then care petition case number for 3.3.6. And the note actually saying that, all right, this is actually the petition case number on the court form. Yeah. We don't have that yet. So we're just going to enter a random like petition number. So let's say it is 1 through 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. And then for date of the care petition file, we're just going to enter a random date for now. But when you have an actual client, make sure you use the date that the petition has been filed. And let's assume that it is November 1st, 2023. Yeah, it is just a random date. 3.3.8. For Maine, we don't know the date of investigation, and it is not applicable for her. And in order for us to know that, you need to enter 090998. You need to do that, and on the back end, when we see that, we know exactly what you mean. Yeah. So we're gonna enter 0909 and 998. Yep, for the date. Everything on here has been validated. Has a validation rule. If you enter something not correctly, it is going to tell you to go back and fix it before you can move on to the next page. Yeah. Like for example, right here, if I enter something that's not a date, right, it will not allow me to move until I fix it. Yeah, okay. 3.3.9, this one asking about original care petition. And we know that, all right, the person who refer Maine to like the care program, it is actually a family member who live with her. So we're gonna select the first option. Okay, we're gonna select the first option. After you do that, technically you finish like entering all the required data from like 3.3.1 all the way to like 3.3.9. That is everything for the basic client information section. Yeah. And then once you feel comfortable with all the value that you provided and you make sure that they are correct, you can go to the next page by clicking next below here. Okay. And for whatever reason, if you want to go back and fix it, just click on preview and it will take you back to the previous page, and you can just fix your like value from there. Okay. And now we can click next. The next page after this page, it is going to be asking you for demographic information. When you are taking the survey or using the template, basic client information and demographic information are always going to be required. For existing like client who already in the system, in order to like reduce the burden for the county, we added this extra data point. As you can see, right, we don't have the like the data element or the data point number right next to it. We put this here so you can basically answer it, and it can allow you to skip the demographic information section. Yeah. If the client is new, if you have a new client, or you have an old client that like already in the system, but you have new demographic information, you can select yes, right? And then when you click next, it is going to be directly you to like the demographic information section. But if you select no, right? If the client it is in existing client and you do not have any like demographic information to update, and you click no, it is gonna skip the demographic information directly and take you all the way to like the current care status section. Yeah. Let's go back. Let's assume that for Ming, like right now she's already on the care plan. Okay, she's already on there. And let's assume that we have new demographic information for her, and we need to enter those new demographic information. So we're gonna select yes right here, okay? And then once we select yes, right, we can click on next, and then it is taking us directly to the demographic information. Yeah. And on here, and if you like have the flowchart open, you are required to report what 3.4.1 all the way to like 3.4.14. Okay, 0.14. And for the demographic information, you can also notice that we have two branching data points. It is what tribal affiliation and tribal services, and those two are actually branching off from 3.4.2 race. Yeah, and on the flowchart, it is saying that, all right, for those two to come out, you need to select like Alaska Native or American Indian. Yeah, this option need to be selected in order for you like to get to like those two data points. So now like if I select that, right, if I select this under race, and if I go next, it is taking me like directly to tribal affiliation and services. If I don't select that, and I select another race, right? If I select another race, it is gonna skip that two data point and take you directly to current care status. Okay. Let's go back to demographic information. Now I'm just gonna quickly like walk through like how I'm gonna answer the question for the demographic information section. Okay. So for Meng, she's a female, and she's actually Chinese American. So I'm gonna select Chinese. I'm not selecting Native American right here. So I should not get those two data point about tribal services and tribal affiliation. She's Chinese American, ethnicity for 3.4.3. I would say like not Hispanic. And then for disability, I would say, all right, let's just assume that she doesn't have any disability at the moment. So I'm gonna select none. And it is like very interesting here. Like we put the function on it. So if you select anything else, right? And if you select none, it's gonna click out the rest of the option. Yeah. So when you select none, making sure that all right, the rest of the option are not selected. And inside SurveyMonkey, we do that, so it will clear out automatically. Okay. So let's assume that it is none. Preferred language. Let's say she prefers to speak English. And then for sexual orientation, let's say straight. For gender identity, for 3.4.9, we can say, all right, she's a female. For employment status, right now she actually not working, and she actually looking for work for, yeah. So we're gonna select this option right here. Okay. U.S. Veteran, she's not. U.S. citizen, yes, she is a U.S. citizen. And then for health insurance status, she actually on medical, so we can select Medicaid right here. We also indicate that you can select more than once. Yeah, so every time when you see that, or when you see a box like this, you can actually check more than once. And for main, just Medicaid, so we're gonna select that one. And we also require that you report the zip code for the client. And we have detail on here. Even if when the zip code is not available, we tell you exactly what to do down here. Yeah. So make sure you read the additional specification. For Ming, we don't know it yet. So let's just use a random zip code for her for now. So we're gonna enter 5, 5, 5, and 5. Yeah. Once we do that, we have answer all the required data point for demographic information, and we can just click next. Okay. And when we click next, it is going to be taking us to like this page right here about current care status. Okay. And on here, we show you like the additional specification for current care status. before like answering the data point. The reason is that like that data point is very, very important. It tells you exactly what you need to report. So that's why we put it here for you to like basically go through it, make sure you understand it and feel comfortable before you like start answering that data point. On here, we learned that 3.3.10, it is always going to be like required. Yeah, it is always going to be required for every reporting month. And if you have a client, right, who has a change of care status, in like within the same reporting month, we want you to submit the survey twice. Like for example, like you have someone going through like the care process initiation period, and then 20 days later, within the same month, right? That person actually got into the care agreement. Yeah, we want you to like report like the data for the care process initiation period to establish the baseline, and then from day 20 to like the last day of the month, that person also will be receiving services, right? So we also want you to report data for the active service period. Yeah, so we want you to like fill out the survey twice. And for us, we highly recommend that you read this and make sure that you feel comfortable before like going to the next page. Yeah, and I have been going through it, so I feel like all right, I know what I should do, so I can click next. Okay. And when I click next, it is taking us to like the most important data point. Okay, it is actually 3.3.10 current case status. It is very, very important, and it must be reported every reporting month. Based on what you select for the care status, it is gonna be it is gonna determine everything that you need to report back to the HCS. There are 8 different care status, like from 1 all the way to 8. Okay. Option 1 to option 3, so 1, 2, and 3. Those options basically only can be used for client during the initiation period. Yeah, so only when you like first started and you're going through the initiation period, then you can use like the first 3. And then the 4th one through the 6th one right here. These 3 are the 3 that county behavioral health agency are required to track. Yeah, either you are an elected client, you are a client with care agreement or care plan. Yeah, so county behavioral health, they will be required to track data for this 3 track. And basically this 3 track will be in the active service period. Yeah, so once you like basically gone through it, then you'll be in the active service period. And then the 7th one gonna be termination. Okay, the termination status can only be used if you enter the active service period, either as elected client, either as a client with care agreement or a client with care plan, and you got terminated from that, then you can use this status right here. Yeah, you cannot like basically move from care process initiation period and then the next month you report termination. You cannot do that. If you do that, we're gonna basically we're gonna validate the data on the back end. If we see something like that, we'll be reaching out to you. Yeah. If you select like care process initiation, if it is dismissed, then you'll be using either the 2nd or 3rd option. Yeah. The last option gonna be graduation from care plan after 12 months with a care agreement or after 12 months of elected services. The last one, you can only select that if the client complete the active service period. Yeah, if the client complete that, then technically it will be the last option. Okay, and if the client got terminated, and then it will be option 7. So based on like the status that you choose for the client, it is going to show you like what data point you need to be reported. And in this demo, we just going to be using like 2 care status to like walk you through and show you how SurveyMonkey is supposed to work. So first one we're going to show you will be the dismissal status, and second one we're going to show you is it is the care plan. And the reason we do that is that like active care plan, it has almost all the data point. if we show you through it, you will see how everything's supposed to work, right? Yeah, because it contains like almost like all the data point from the data dictionary. All right. First we're gonna show you like the dismissal status. Okay. Right now, if you look at Ming, she's already on the care plan. Let's assume that during the care process initiation period, she got dismissed. Okay. Yeah. So she got dismissed and she never like passed through that period. So we need to report the dismissal period for her. So we're gonna say, all right, she got dismissed, and we also assume that she's not receiving county support and services. So we're gonna select the second option, and then we can click next. If you look at like the flow chart that you have open, it is gonna tell you that, all right, if this status is selected, you're only required to report one data point, right? And again, don't look at the full flow chart as a whole. Like focus on the specific status, yeah, and then go down from there. And if you go down the dismissal status, it's telling you that, all right, you're only required to report the date of dismissal. And once you do that, the survey should end automatically. Yeah. I don't want the survey to end and start over, so I'm just gonna show you how it's supposed to work. Yeah. So let's assume that, let's just provide a random date. Let's assume that she got dismissed today. Okay. And she never got to like what the care plan, and she got dismissed. So we can select like what November 1st, 2023. When you click next, the survey should end automatically. You are not being direct to any other data point. Yeah. And then once you tell us the dismissal date, you are no longer required to track this client. Okay. And also one other very important note, if it happened within the same reporting month, make sure you report the data for the initiation period, and then submit another survey telling us about the dismissal date. Yeah. So make sure you do that. If I click next here, the survey gonna end, and I don't want that. So let's just click on preview to go back. Okay. So that is what the first example, and the next one gonna be what active care plan, and this one is very, very long. And if you look at the data flow chart, it has almost all the data point. Yeah, that's why we decided to do that one, so you can see how everything's supposed to work. Okay. Right now, May, she actually on the care plan, so we're gonna select like active care plan, and then we can click next. Right. After clicking next, right, it is what gonna take you like to like the services and support section. This section, it is very, very long, so we're gonna focus on like small subsection. Okay. We also have the statute language for you here, in case you wanted to see, all right, like the statute number that require for services and support. We put it here. Okay. Once you feel comfortable, you can click next to begin. The first small section gonna be focusing on mental health treatment services. The first data point asking us gonna be what about the mental health services that were provided to the client, or I mean to Maine during the reporting month. Okay. For her, let's just assume that, all right, adult crisis residential services, adult residential treatment services, and crisis intervention has been provided to her. Okay. So those three has been provided to her, so we're gonna check those three options. And then once we check those three options, we can click next to jump to the next data point. Okay. Next gonna be what 3.5.2. Okay. So it takes us directly to like 3.5.2. But if you go back to the flow chart, you also notice that, all right, we have blanching data point. Okay. And now we are not getting those blanching data point, and why? So let's go back. The reason is that we do not have medication support selected yet. We do not have that selected. So that's why we actually skip the stabilizing medication section. For Ming, right, we know that she's not adherent to stabilizing medication. And the doctor decided to put her on the long-acting injectable antipsychotic medication. So they decided to put her on that. Okay. So we're gonna select like medication support right here, okay? And on the flow chart, if I click next, right, it is telling you that, all right, now I will be going to stabilizing medication, okay? I am not skipping that section since I indicate medication support. She's receiving the long-acting injectable medication, so we can say, all right, yeah, she is getting that. So we can say, all right, yes for 3.5.6. The type and also the adherent, those two data points depend on this one, right? If you check yes here, you're gonna be asking you for the type and also asking you how she actually adherent to the medication. If you select no or unknown, it is going to be taking you back to like 3.5.2, okay? So I'm going to select yes for stabilizing medication and then click next. And then 3.5.7 asking if long-acting injectable actually being provided. I say yes. And then now it is asking about the medication adherence. She is receiving the long injectable medication. And the current dose, it is actually not due during the reporting month. So it is going to be option 1. So 80% to 100% of the time. Yeah, because she already get the injection. Yeah. And then we can select yes right there. And then once we finish the stabilizing medication, it is going to take us back to like 3.5.2. Okay. And now it is asking, all right, what actually like listed on the care plan. Okay, so here on the care plan, so now 3.5.2 asking, all right, what mental health services were on the care plan. Right here, let's just assume that, all right, we're gonna select like adult residential services and then crisis intervention, just in an example. On the flowchart, you also notice that like if you select medication support, you're gonna be directed to a branching data point. But let's assume that this one has not been listed on the care plan, only the first two. Okay, so we're gonna select the first two and then we can click next. All right, so the next one. All right, so once you indicate what actually listed, right, and now it is actually looking at that list and then telling like it is now asking, all right, so adult residential and then crisis intervention has been listed, and you want to know like which one actually not provided to the client. Okay, so you want to know which one actually not provided to the client. Services and support not provided and the reason, those two data points actually loop together. If you indicate that adult residential actually not provided, you need to provide a reason. So SurveyMonkey gonna loop you to like the reason, and you need to provide the reason. Like if I say, all right, this one is not provided, right? If I click next, okay, and then now it is looping me like to provide a reason. Let's go back. If I say that, all right, both actually has been provided, then I can say none. If I say none, it's gonna take me out of what, like the mental health treatment services, and now it's gonna jump me to like the next small subsection of support and services. So if I select none here, it takes me directly to the next small subsection. That will be substance use disorder. Okay, it is not directly me to the reason because I everything has been provided. Let's go back. And let's go back to like 3.5.2. Okay. So 3.5.2 asking like what actually listed on the care plan. If I indicate that, all right, nothing has been listed on the care plan, right? If I select none, okay, if I select none, when you select none, you should not be asked about what not provided and also the reason for those services and support not provided. If I select none for 3.5.2, it is taking me directly to like what the substance use disorder treatment services section. Yeah. So it should basically skip like what the not provided and the reason and taking you directly to the next small section. So the next small section is going to be like substance use disorder treatment services. This section, CalAIM section, social services and support section, those three actually follow the same structure. First, it is asking you like what actually been provided. Second, asking you what actually listed on the care plan. next asking you like, all right, from the care plan, like from the list, which one not provided? And then based on how you answer, it is going to be asking you like what the reason for that. Okay, so it follows the same structure, and we just doing the training, so I'm not going to show you how it's supposed to work for substance use disorder. Yeah, so I'm just gonna like basically skip like those 3 small sections and then go all the way to specialized program. So on here, I'm just gonna like basically give random answer and then go directly to specialized program. So count in, I can say none. All actually follow the same structure. Yeah. So let me say support and social service and support. Let me say none. And then social service for social service listed in the care plan, we can say none. And then now we get to like the last section of service and support. That will be for specialized program. Okay. So for this one, it is asking you for to see like which specialized program that the client or main actually engage in during the reporting month. If you look at the data flow chart, you see that like if you select full service partnership, you're gonna be direct to what to like you're gonna be asked for a specific kind, like what kind of like full service partnership that the client actually receiving. Okay, so you'll be directed to that. But if you don't select this and you decide like, all right, the client is not getting that, right, and the client getting something else, and you select the other specialized program, okay, you'll be directed to you'll be asked why the client is actually not engaging in full services partnership. Okay, so for Ming's case, let's assume that the reason why she's not engaging is that the spot actually full. So we're gonna select the first option. Okay, so we're gonna select the first option, and then we select that, and then we can click next. All right. Once you like click next, that should be everything for services and support. Yeah, so that should be everything for services and support. And now you actually on the new section, that will be housing placement. So give me a second. Yep, so that will be like housing placement, and then once we feel comfortable, we can click next. All right. So for housing placement, we only have 2 data points. You can also see that in the data dictionary, and you can also see that in the like full detailed flow chart. Okay, so that's gonna be 3.6.1 and then 3.6.2. For Maine, we know that she's actually in a home board and care facility. So that will fall under institution. Okay, so that will fall under institution. If you want to like basically get the full list, how we categorize like into homelessness, institution, temporary, permanent, please like look refer to the data dictionary and go to appendix G. Yeah, so we have like the list there. You can look at it. And since she's in the board and home facility, she will fall under institution. Let's assume that for Meng, when she's there, the bleach program actually paying for it. So let me see, behavioral health community. I cannot locate that behavioral health supporter. Bleaching program transitions. We have the bleach option here, but I cannot locate it. Give me a second. Home support behavioral health. Yep, right here. So like the let's assume that the behavioral health bleach housing program actually pay for that. So we're gonna select that for Maine. Okay. Once we answer that, that should be everything. Yeah, and then we can click next to like jump to the next section. And next, it is actually gonna be like substance use. as you can see, right, from SurveyMonkey, from section to section, it followed the order of the data dictionary. It is not giving you like random order. Yeah. So we're starting from what demographic, and then we started from basic client demographic, support and services, right, and then housing. Yeah. So it followed the same order. Okay. It is not like giving you like random order. Substance use. Okay, so we can click next once we comfortable with the statute language. And if you look at the data flow chart, you will be required to basically report 3.7.1 all the way to 3.7.6. Okay, and you also notice that we have a branching data point that is actually for alcohol. And if you look at the specification for alcohol, right, that data point only come up if the primary substance use or the secondary substance use, if those two are not alcohol. Yeah, alcohol is kind of like on its own like quotient, but if you indicate that, all right, the primary use, it is actually alcohol, that means you already answered the alcohol quotient. So that quotient shouldn't show up. But if you indicate something else for primary and secondary, then you'll be asked about the alcohol quotient. Okay, so let me just like go through the quotient, and then we can see what happened. So for diagnosed substance use disorder, we can say, all right, let's assume it is a yes. Illegal misuse or controlled substance use in the reporting month, let's assume it is a yes. Okay. And then for primary use, we can say, all right, we can pretend it is marijuana. And then the next question below that should be asking about the frequency. And let's assume that she used it once per week, right? So we can say, all right, for marijuana, 1 to 7 days per month. Okay, so we can select that. And the next one asking about secondary substance use. Okay, and let's assume that it is actually PCP. And let's assume that she used it daily, so it is going to be what 22 or more days per month. And as you can see, right, alcohol is not selected. 3.7.5 alcohol is not selected, and then 3.7.3 alcohol is also not selected. From the data flow chart, you know that, all right, now I'm getting the alcohol quotient. So if I click next, yep, it is directly due to like what the alcohol quotient directly due to 3.7.7, and it is asking, all right, the frequency that the client actually use alcohol. Let's just assume that we don't have that detail, and the detail is not available to us. We try to locate in her medical record, but we couldn't locate it. So we're gonna say, all right, we're gonna select unknown, and then we can click next. Okay. When you click next, it is taking you directly to like what the next section. So going to be detention and LPS. Okay, detention and LPS. We can click next again. So for detention and LPS in the data dictionary, we only have 2 data points. For Meng, let's assume that she has a 14-day LPS hold, and she also has been put on a temporary conservatorship for 30 days. Like, let's just assume that happened to her. Okay. So for 3.8.1, asking about LPS hold, you can select like 14 days. And as you can see, right, if there are more than one hold, right, you can select multiple. Yeah, you can select multiple. And then for 3.8.2, she has been placed in a temporary conservatorship for 30 days. So we're going to select that, and then we can click next. Okay. And that should be everything about detention and LPS. Next, going to be criminal justice. Okay, so criminal justice will be the next section, and we can click next again. It is like very, very long. If someone who actually understands the data dictionary and also like have everything open, I think the longest take gonna be like 20 to 30 minutes per client, or like sometimes it can take like up to like what. Like the minimum gonna be like 15 minutes per client, yeah. And then for criminal justice, let's just like provide random answer for Meng, and then we can jump to the next section. So for Meng, let's assume that like criminal justice status, let's assume that she is waiting for trial. Okay. she is waiting for trial. 3.9.2 asking about how many times she has been arrested in the reporting month. It is a multiple choice question. If the client unable to answer, you can say unable to answer. If it is unknown, you can say unknown. But if it is knowing, right? If you know like the number of arrests, you're gonna select the third option. When you do that, you need to provide a number. Yeah, so you can enter a number. For Meng, let's assume that, all right, she has been arrested twice in the reporting month. So we're gonna enter 2, okay? We embedded validation on it. If you enter a big number or a number that is not falling into that range, it is gonna prompt you to go back and fix it before you can go to the next page. Yeah. So let's assume that it is a 2, okay? And then jail, we can say, all right, we don't know that. So we select unknown. Prison in the reporting month, let's say, all right, let's say 3. And then contact with law enforcement, and let's say, all right, let's just enter a random number. For example, if I enter 1,000, right, it's all like randomly enter 1,000. If I click next, right, I cannot go anywhere. I will be directed back to this question. Say, all right, yeah, it is actually not right. Yeah, so let's assume that, all right, law enforcement should contact like 5 times, and then we can answer that. Once we answer that, that should be everything for criminal justice, and it should take us to the next section. Yeah, and that should be death and cause of death. And once we like feel comfortable about the statute language, we can click next. From the statute, we also require to track like report the participant death. So the first data point will be asking you 3.10.1, asking if like the participant, like did the participant pass away, or is the participant still alive? And from the data flow chart, if you say yes right here, right, it is going to be pop you to branching data point. You need to provide the date of death, and also you need to provide the cause of death. Okay, so it will direct you to those 2 data points. But for Meng, she's still alive, so we're gonna say no. Okay, if we say no right here, it is just gonna basically jump us directly to the new section. It is not asking for like it should not asking for the date of death or the cause of death. She's still alive, so I'm gonna select no, and then I can click next. Okay. So next is gonna be like volunteer support and PAD. Okay, so we can click next to begin. So first, asking if she actually has elect a supporter, has a change of supporter, or remove a volunteer supporter in the reporting month. If you select yes right here, right, from the data flowchart, if you select yes here, it is going to be asking you for the relationship of the supporter, and then it is also going to be asking you why the supporter has been changed, right? So you're going to be directed to like those 2 data points. For Meng, let's just assume that, all right, she has not selected a supporter yet, so we can say, all right, no. If we say no, then we shouldn't be asked for those 2 data points. It should take us it should take us to the voluntary supporter present data point. Yeah, so it's taking us here. Let's go back. Yeah, if I say yes here, right, then yep, I will be prompted to like provide the relationship of the supporter and why the supporter has been changed or removed. If it is the first time that the client actually selecting a supporter, you can say, all right, it is not equitable for this client, so you can just select this option. Okay, so I'm gonna go back and I'll say, all right, no. All right, so 3.11.4, this one asking if the supporter actually present in any of the event. For Meng, she doesn't have a supporter yet, so technically it's gonna be none. Yeah. If she has a supporter and if the supporter showed up in any of this event, you're gonna check them, and you can check multiple. Yeah. But for her, she doesn't have a care supporter, so we're gonna select none, and then we can click next. And next should be PAD. And PAD, if she has established a PAD, then you're gonna select yes. And again, we want you to pay attention to like the specification. Right here is saying that, all right, once you answer yes, right, if the current reporting month you answer yes, the next one you can just leave it blank. Yeah, you can just leave it blank. You don't need to re-enter the date again. Okay. From the data flow chart, if it's like yes, you'll be pumped to like what enter a date. If you say no, you're gonna be what skip to the next section. Let's assume that she has a PAD established in the current month. So we're gonna select yes right here for Ming. And then we can click next, right? And now it is asking for the date. And we're just gonna enter a random date. Okay, so we're gonna say, all right, she established November 1st, 2023. Once you report this, the next time, like for next month, you don't need to re-enter for this two data point for like 3.11.5 and 3.11.6. Yeah, you can just skip those two directly. Okay. Once I enter that, I should be finishing the section, and I will be directed to the new one. This one is the second to last section of the survey. Okay, so it is going to be asking for care plan, care agreement, and graduation. Okay, so we can click next to go to the next page. Main actually on the care plan. So everything on here, we should not be asked about care agreement. Yeah, we select care plan, so we are getting care plan quotient only, and those two should be 3.12.2 and 3.12.3. Okay. The first one asking like the date that the care plan has ordered. We're just gonna provide a random date for now. So let's say November 1st, 2023, and then the date that the court complete the care plan. So we can say, all right, it is. Let's assume that it is the same date, so November 1st, 2023, okay? So those two questions are related to the care plan. If anything come up related to care agreement on your side, please let me know, and then I can fix that, yeah. After we answer that, we can click next to go to the next data point, and next is gonna be asking about the 1-year status hearing. And if you look at the data flow chart, if it's like yes, right, you will be pumped to basically answer the outcome of the 1-year status hearing. If you select no, you will be jumped to the last section of the survey. Yeah, and let's assume that Meng has been gone through the care process for 12 months, and the 1-year status hearing actually being she already has the 1-year status hearing. So we're gonna select yes right here, and then we can click next. Okay, so when we click next from the data flow chart, we will be pumped to answer the outcome. Okay, so the outcome, there are 3 options, and you also notice that there is a blanching data point. If you select that Meng elected to graduate from the care program, right, then you'll be asking, right, the court and the county establish a care plan, a graduation plan for Meng. You'll be pumped to answer that. If you don't, you answer option 2 or option 3, then you'll be jumped to the last section. Let's assume that during the 1-year status hearing, Meng actually select to graduate, right? So she select to graduate. We select that. The next one will be asking did the graduation plan actually being developed for Meng, right? We asked this, so we want to know if once she finished the program, did she we want to see if she's gonna be continue to receive the support and services that she need, right? So let's say that the court and the county actually establish a care plan, a graduation plan for her. So we can say yes right here. Once we do that, we will be jump to the last section, which will be for hospitalization and emergency department visit. Yeah. So follow the same order from the data dictionary from top all the way to the bottom. And the bottom section gonna be hospitalization and emergency department visit. We can click next. And for this one, it is very short, only 2 data points. So 3.3, 3.13.1, and then 3.13.2. First one asking about inpatient hospitalization. All right, so let's just assume that she has 2, so we can enter 2. I also put the note right here, so it can be 0 to 92, 99. And then for emergency department visit, let's say 3, okay? And again, make sure you look at the specification in red. Right here, we say that do not count emergency department visit that led to inpatient hospitalization. We don't want to double count, so that's why we put the note down here. Yeah. So with that, you will not like double count. These two are the last 2 data point that you need to answer. And if you click done here, you will be technically you will finish the survey. But before you do that, make sure you are okay with all the answer that you provide. Because when you click done here, you are not able to go back. Yeah, you are not able to go back. And the only way to fix the data is that you contact the data team, and the data team either will fix it manually on their end or will basically export the data back to you and then you fix it, right? So before you click done, making sure that everything has been entered correctly. Yeah. And for main, we show that we enter everything correctly. So we're gonna click done. Once you click done, it is taking you to a thank you page. And on here, we also listing the link to the request form. If you have any question, you can just use that form to submit like the question to us, and we will respond to you. And we also put a note that if there is a change of care status within the same month and you need to submit another survey, then we want you to like do that. Yeah, so we add the note right here. Once you click done, it is gonna be directly you back to like the survey, and you just need to enter the password and then just take the survey again. Yeah. So that will be like the end of the survey. Carly, can you go back to the PowerPoint presentation? So I'm gonna stop share. Okay. Yep. So with that, we actually like reached the end of the survey and also the end of the demo. I will now like basically we'll look at like the chat to see if we have any question that have been submitted to us. Yep. And if you have any question that you would like to get an answer, please use the chat feature to submit them now. Yeah, and I can take a look at that. So.
And just a note, I know we have 10 minutes left. Gather your questions. You're probably processing some of the information that Cha has presented. I did want to note that there is also an additional office hours scheduled for this upcoming Thursday. That office hours is facilitated by Desert Vista Consulting, but we do staff it with individuals who have experience on different work streams, including the data work stream. So we have 10 minutes to ask and answer questions, clarify, but then if you need time processing the information and you have follow-up questions as you become more comfortable and familiar, then we also have those office hours set up. And again, that's scheduled for this upcoming Thursday. If you don't have access to that information and you do want to get that invite on your calendar so you can join, feel free to email the CARE Act TTA admin email to get added to that. So I wanted to open up the question. I see a question from Nancy Callahan. So Cha, Nancy asked, what do you use as a client unique identifier since we need to re-enter data on a monthly basis?
Like when we going back to like the first 2 like data element, right? Basic client information and demographic information, those will be used as identifier. Yeah. And the most important one that we're gonna use is gonna be the name, the last name, date of birth, and also the social security, or the medical beneficiary number. That's why we ask you to be consistent. You cannot just like report different one every month. Yeah.
Okay. So just the last name and date of birth and Medi-Cal number or whatever ID number is. Okay. Cool.
Yep.
So you would enter that each time, and then you could move out of the demo section if that was all you had to enter.
Yep. Or I mean, like when you are doing that, we prefer that you like for the basic client information, you will basically first answer everything. For the demographic information, you only need to report it once. Like if you are having a new client, then you're gonna report it. But if you're not reporting a new client, you're reporting a client that already in the system, then you can just skip it. Yeah.
Right. So there's a place earlier where you can just enter those few things rather than all the demos.
Yep. That's right. Yeah.
Okay. Thank you.
And then Cha, I'm seeing another question from Matthew. He says, if somebody enters the care process initiation period in the middle of the month, let's say the 16th, should the questions such as number of jail days be answered for the entirety of that month or just from the 16th to the end?
So just okay, so if we go back to the number of jail, right? Okay. So that would be like from like the beginning of the care initiation process to like what the end of that. Yeah. So that will be that time point. That's why we require you to report to survey if there is a change like that. So
Matthew, did that address your question? Do you have any follow-ups?
Yeah, I think so. So I just want to confirm, I'm not meaning when you're switching from the initiation period into the active service, but if someone starts the care process initiation in the middle of a month. Just because the phrasing of the question, like how many days plus the client present in the reporting month, suggests it should be for the whole month, but
yeah,
wasn't sure. Yeah.
Oh, sorry. Yeah. So sorry, I thought that the 16 is the day that the client actually finished the initiation period. So if started in the middle of like the month, right, and then what at the end of the month you are reporting data for like the number of arrests, number of jail day. We want the whole month. Yeah.
Okay. Thank you.
We want the whole month.
And Cha, another question from Susanna. I believe I know the answer to this, but do you know how they get access to MOVEit portal to submit data files? I believe it's not open yet.
Yep. Right now it is not open yet. We are working with the DHCS team to set up that for the county. So that's why we send out the email asking like who should have access to MOVEit. Yeah. So only those people who have access to MOVEit from each county will basically can submit the data. And the file template, we already have that, and we will be providing training like how to use the template, and also like how to submit that template through MOVEit.
Great. And Chloe just mentioned in the chat, but if you have a question specific to TTA, she provided a form that in the chat that you can click on. And I just wanted to point out, Carice added a note. So we use the word report a lot at the beginning. Obviously a word that has multiple definitions, both reporting as in for data and collection purposes, but wanted to specifically call out reporting somebody to care can have a negative connotation. Technically, we're referring them to the care process through a petition. So it's not a punitive process, but in terms of data and collection, we use that term. So I just wanted to provide just that small clarification. And then Cha, I see another question from Susanna. If the county is providing a data file, if we have previously provided demographics, do we need to provide those demographics again?
Yep. I mean, for the file template, it is very easy. You can just copy and paste. You don't need to like re-enter everything yet. Just like highlight the whole demographic section, copy it and paste like into that row, and then continue from there. Yeah.
Susanna, any follow-up questions there? Okay, well, feel free to follow up in the chat. And then Sharon had a question. So this is in regards to the Social Security number and Medi-Cal number. Let's say at the beginning of the process, when they're filling out the information for the first time, if the social security and Medi-Cal number are unknown to the client when the client starts the care process, does that mean they are to continue using unknown for that information throughout, or can they enter it if it becomes known later on in care?
Yep. So when you first started, right? So for example, the first like 2 or 3 months, and that information is not available, you use the 9999 code first, and as soon as that information become available, for the next reporting month, use either the Social Security or the Medi-Cal, and once you start using that, continue to use the same number. Yeah.
Okay, so I think, and just to follow up on that, so you had talked about, what that unique identifier is, if they're entered for the first time without information, and then they learn it later in the process, those two people will be linked in the system, or how do we ensure that the information is linked?
Yep. So
if it's added later.
Yeah. So once it is added later, right? We have a flag on the back end. We're gonna look at that flag. Once it has been added, we're gonna go back to like the previous record and change everything to that Social Security or to that Medi-Cal beneficiary number. Yeah.
Got it. Sharon, any follow-up questions there?
Just one in terms of if once then we switch and we find out that we either had a typo or incorrect information, then we would just follow the link, the technical assistance link, to have that updated then?
Yep. Like submit the form, and then I will basically reach out to you, right? And then you can provide me like the client like detail. I can, if it is something very, very small, I can just fix it automatically on my end. But if like you have more than one client, or you have like a huge chunk of information that you need to fix, I'm actually gonna basically hand back the data to you through MOVEit, and then you can fix it from there. Yeah.
And then I think that this will be our last question that we answer live. But again, please request to join that office hours on Thursday if needed. So this is a question from Nancy Callahan Shaw. So do you collect information on the 60-day progress hearings? And then there's some more questions related to that, but do you want to answer that first part of the question?
So like I think that question, Serene, can you help answer that question?
See, so here's the issue, right? So we know that trial courts are responsible for collecting a bunch of information related to the trial court process. So that will actually fall on the trial court. From the county behavioral health end, your responsibility really is to track information on clients that actually flow through the county. So for example, if a person, let's see, so you're saying they have a care agreement, so you will be tracking that. But the pieces of information that you're responsible for tracking on that overlaps with the court process is the initiation period. So whatever data that you need, whatever data that you submit for the initiation period, which is when they are going through the petition process, you will submit to DHCS. For the other information in terms of the number of hearings, initial hearings, disposition of hearings, and what have you, that will be collected through the trial courts, and the trial courts will actually submit that data to JC. Does that make sense, Nancy?
Yeah, except that behavioral health is required to attend all of the progress hearings.
Gotcha.
And so I was, kind of surprised with all the data that you are requiring that you don't have any information on those progress hearings and
and that's
the status
because
of what you're doing with them.
Yeah, Nancy, it's a good question. And that's one of the things that we had worked out with JC. So we're not duplicating efforts. So JC, Judicial Council, will be working with the trial courts to collect that detail and then submit it to Judicial Council.
Okay. And then my other question is more complicated, but at the end of, if you have a care agreement and you go to that first 60-day progress hearing, then the courts are no longer involved in that person's care. So the question is how much longer is behavioral health reporting on all of this monthly data?
So it
that's more
depends on the
complicated for you guys.
yeah, so it depends on the status, Nancy. So if you like, find an office hour, we can walk you through the care status. So when the individual is dismissed, there are, several options you can follow, right? So if they're not eligible for care, County BH just gives the date of dismissal, you're done. But if they were eligible for care but diverted and becomes an elective client because they opted to receive services outside of the care court process, and the judge and county agrees to that, then County BH will continue to track the individual who is now called an elective client in the same time frame and following the same measurement period as if someone had an actual care agreement and a care plan.
Okay, and then for how long would you be doing that, Serene? Thank you.
So for a year, so 12 months. So same thing, 12 months,
okay.
and then another follow-up 12 months after that, if where possible.
Yeah, and I think that's a piece that I'm not sure behavioral health always understands. That's kind of the fine detail that we kind of discovered as we were going through the pilot. But so that might be good for you guys to kind of note in your data collection somewhere so people keep submitting that data.
Yeah, no, for sure. I know we covered that in the asynchronous training that happened. Oh gosh, I'm blanking on the date now, about a month ago. So folks, if you have not listened to the asynchronous training that we put out, it would be good to do so. And obviously, it is, I think, like you said, Nancy, not an easy process to understand because it's really complex. Feel free to reach out via the TTA form and we can sit with you.
Okay, well, I appreciate your information today. It was a good presentation. Thank you.
Great, thank you.
And I just popped that link to the training in the chat. I know we're over by a few minutes, so some people may have had to drop by now. But again, we'll follow up in an email with the link to this recording, the slides, and we can also include a link to some of these resources as well in that follow-up email. So if there are no other questions, then we will close out today. A reminder of these objectives: to identify the responsibilities for data submission and understand the flow chart. You might need to take some more time to understand that flow chart in depth. And then let's look at how you can, on the next slide, we have some contact or some next steps. So coming soon, keep in mind that MOVEit platform demo will be upcoming. And we will share that information. Please take the evaluation after this training and let us know what further questions you have. You have that email address that you can reach out to. And we have those forms listed that you can click on to request TTA specific to data. But there is no wrong door. So if you aren't sure who to contact or what form to use, just email us at that email address, and we'll make sure you get connected to the right person. And then on the next slide, I believe we just have our some links to different resources. Again, these links will be coming to you in the email address, but some FAQs related to data collection, the data dictionary, and that flow chart that we linked to earlier, a summary table that you can perhaps print out and have on your desk. And then we'll be coming out with a data quality assurance checklist, and we'll make sure that gets sent out to everybody. So if you have questions here, we have that drop down in where you could submit that request. But again, there's no wrong door. So please feel free to reach out at any time and get that information. So if we're, like I mentioned, we're over a few minutes. So thank you, Cha and Carice and everyone that stayed on and asked questions and clarified. Let us know how else we can help support you and what other questions that you have. So thank you so much, and we'll be in contact soon.
Yeah.
Thanks, everyone.